Glaucoma is a condition where the optic nerves, which are the wires that take the messages from the eye to the brain, get damaged over time and result in loss of sight. Age is the most common risk factor, so above the age of 40, 1 in 50 people have the most common form of glaucoma, and this rises to 1 in 20 above the age of 80. Another important risk factor for developing glaucoma is having a close relative with the disease. So if you have a brother, sister, or parent with glaucoma, it is thought your risk of developing the disease is increased fourfold. Therefore, it's really important you have your eyes examined regularly if you have a family history of glaucoma. Certain ethnic groups are also more at risk of developing the disease. For example, Afro-Caribbean people have a fourfold increased risk compared to their European counterparts. Being short-sighted and having medical conditions such as diabetes also increases your risk of developing glaucoma. Glaucoma is a condition that has relatively few symptoms early on in the condition, but if unchecked or unmanaged, then later on patients will start experiencing all the effects of sight loss. In the past, we often used the analogy of having tunnel vision, which was a very poor analogy, which actually patients do not see black bits in the vision. More likely, they'll become aware of blurry patches if the disease has become quite advanced. They will also become aware of the consequences of sight loss. For example, they might miss curbs, they might bump into things, and eventually struggle to drive. These things make a massive difference to people's day-to-day activities, and life can become quite difficult if not treated. All these symptoms occur quite late on in the disease, and ideally we would like to pick it up at a much earlier stage before a patient notices the symptoms. There are other types of glaucoma which present with symptoms, for example, of severe pain, a red blurry eye, and loss of vision, and this can be quite dramatic, and these are situations we advise people to seek urgent medical attention. Ideally, opticians will assess you for glaucoma using a variety of techniques, including measuring the eye pressure, measuring your peripheral field of vision, and also by looking at the nerve which gets damaged in glaucoma by either taking a picture of it or using a specialist scan. If they pick up any risk factors in your history, or if any of these tests flag anything suspicious up, they will refer you to a specialist service who will do further investigations to decide whether you need any treatment or if you could be monitored for the condition. If your glaucoma is picked up early on and before you notice any symptoms, there is a very good chance of being able to manage your disease, usually by reducing the eye pressure and thereby preventing any significant sight loss in the future. In most countries, we can achieve this for 90% of the patients we treat. However, if it's picked up too late, or if not treated, or sometimes even if it's treated, patients can eventually develop sight loss that may impact on their quality of life. Thankfully, in the UK, it is relatively rare for patients to develop significant sight loss, as we usually pick the disease up early enough to be able to manage it well. It is less than 10% of our patients who develop a significant sight impairment as a result of their glaucoma. There is nothing specific anyone can do to prevent themselves from getting glaucoma other than living a healthy lifestyle and having a healthy diet, not smoking, and controlling any conditions they may have, such as high blood pressure or diabetes, which all help in maintaining the general health of their eyes and also keeping them healthy in other ways. The only way of preventing any significant sight loss from glaucoma is to pick it up early, and therefore the most important recommendation I would make is to ensure that you have your eyes examined regularly by your own optician, as they will be able to assess the health of your eyes and look out for glaucoma. Eye tests are extremely important in detecting glaucoma, as they allow us to pick up the condition well before a person notices any symptoms. Most patients we actually see in the glaucoma service and even treat for glaucoma risk factors aren't aware of any symptoms because they were picked up at a very early stage by their own optician. There's a common misconception that opticians just prescribe glasses, but actually they are a very important part of the eye healthcare system and can pick up a variety of conditions as well as glaucoma at a very early stage. So the most important recommendation I can make is to ensure that you see your optician on a regular basis so that they can assess the health of your eyes.